So this is about personal and shared responsibilities for the new normal. Now, to cut to the chase, the beliefs and behaviors that I'm going to touch on today, there are three aspects, and I will keep referring to this series of slides as your takeaway for today. The first thing is that community must prepare for the long haul. This is not a sprint, but a marathon. What do I mean? When COVID first hit the world, we thought that it was like another SARS, in 2003, where, oh, by June, it'll be all over. Wow, to our surprise, at June, it was not over. And in fact, there was a possibility of a second wave. So really, what we are seeing now is that the COVID-19 is behaving quite distinctly different from what we had thought of from SARS. And we must learn to prepare for this long battle with COVID-19 as a country, okay? This is not a sprint. It is more like a marathon where we have to keep sustaining ourselves and be able to adapt to every change that the virus does to confound us, and then we have to fight back, okay? The second belief and behavior I will touch on is about how a sustainable society has to rise above self, always give a bit more than you take. Why? You see, if we have a certain pie and everyone keeps eating into the pie without giving anything in return, slowly the pie is eroded and then it becomes nothing. Whereas if we give just a little bit more than we take, then actually it's a growing pie, we eat a bit, but we give back a little bit more. And therefore, the key to sustainability, that is how to maintain a society in the long run, is that all of us must learn not to just take, but also to learn to give a bit more than we take, right? And I will show you some easy steps we can do in this respect. And thirdly, this important thing called trust. I think if you look at the world today, COVID, the way it's managed in many different countries, the outcomes are very different. And if you look at the determinants of the different outcomes, one key factor that comes out is the trust that each society, each country had in their authority, the public health authority, as well as the government. And you can see that Singapore did not do badly because we do have cultivated a long history of competence and relationship between the people, society, and the stakeholders, as well as the authorities, the government, and the private sector. So this trust is very important, and trust is the basis for us built on relationships. So do not take relationships for granted. So let me start now with number one. Community must prepare for the long haul. This is not a sprint, but a marathon. You may have seen this epidemic curve before. This really tells the story of Singapore's COVID-19 experience. And on the eve of Chinese New Year this year, we had this very bad news that COVID had indeed come to Singapore. And from there, it was a big roller coaster ride. It worsened because firstly, we had a lot of travelers who had come from Wuhan. And then following that, the Ministry of Foreign Affairs had also asked our Singaporeans, in view of the uncertainties abroad, to come home to Singapore, but they had already been infected overseas. So this also brought in more cases of COVID-19. And then because our infection control measures were not up to speed in the community, there was community spread and we had local cases, clusters that developed in February, March, April. Professor Teo had already told you about the famous Safra Jurong cluster. There were many others, and our dormitories were also affected. And these I will discuss a bit later. All right. Dormitory residents constituted the bulk of our cases. It was very unfortunate, but it also showed us a lot of learning points. So by last week at 11 December, the last MMS class, we had already chalked up 58,000 over cases of COVID-19 in Singapore. So what phase are we? The circuit breaker was what we call the hammer. That means we had to take very harsh steps. Everybody stay indoors to reduce the risk of transmission, to break the chain of infection. But following that, we started to relax, and then we went into phase 1, phase 2, and now going to phase 3 of the post-circuit breaker. And this would be the dance. Do we know the outcome? No. Nobody in the world knows the outcome. this dance will be like maybe 2 steps forward, 1 step backward, and then another step forward, and then maybe 2 steps backward. We will have to adapt as we experiment to see what works and what does not work, so that when we can return to our normality, to the as much as possible, we will also be safe from infections against this COVID-19. The government has done a lot to keep Singaporeans safe, and this is the situation update as of last Saturday. Singapore dealing with 3 separate sources of infection. I mentioned the imported cases. There are also potential for cases in the community, which so far so good. We are getting 0 right now, and cases in the foreign worker dormitories also. Okay, now thus far, because of the situation abroad, majority of the cases are imported, and fortunately, because we have in place now a monitoring and surveillance mechanism, all are detected during their isolation period. Okay, the new cases in the community have remained low and even 0. Okay, and stable, and we hope to retain this for as indefinitely. Cases in the dormitories, okay, were either contacts of previous cases or detected through our very active surveillance testing now, known as the biweekly RRT or rostered routine testing. So our foreign worker guests in dormitories do undergo routine testing to see that they are free from infection for their own good and for the good of the community. The amount of testing in Singapore has been phenomenal. Okay, we have total swabs tested 4 million over as of November, and you can see that we have a 741,000 swabs per million population. This is a very high number. The total unique number of persons swabbed over 1 million people, and the total unique persons swabbed per million, 202,900 people. These are very high figures because we see that testing is indeed one of the key defense mechanisms currently in the absence of a COVID vaccine. So testing will be an enabler until we can effectively immunize our population. All public hospitals are able to conduct this testing, and on average, we do more than 20,000 swabs daily, and this has a capacity now to up to even 40,000 tests a day if needed. Okay, so Singapore remains committed towards performing the tests required to ensure that COVID-19 remains under control. If you look at the epidemiology, which is the study of the distribution and determinant of the disease in our population, really there are 3 different patterns that have occurred in the Singapore experience. The first one is imported cases. If you look carefully around January, you see a small blip, and that was actually the imported cases that arose from travelers from Wuhan, China, and that gave rise to a few of the local transmissions that had occurred. And then the second wave of imported cases is really our own Singaporeans coming back, having heeded the call by the Ministry of Foreign Affairs that things out there are not good. Do come back because we can assure you of healthcare in Singapore. And that, however, gave rise to a second wave of infections. Okay, today you can see that imported infections continue to be the problem as Singapore opens up, because there are many countries that do not really have COVID-19 effectively under control, and community spread can happen to anyone who chances upon an infected case whilst in the community undetected, right? So we can see that imported infections continues to be a main concern for the prevention and control of COVID. The second level, if you look, are community cases, and Singapore has done a very good job. From the initial setbacks that we have suffered, we have learned very hard lessons, and we have continued to use calibrated approaches to reduce the risk of person-to-person spread. And you can see that now we have a very low level of community cases, 0 on most days. Then the dormitory residents, okay? I highlight this because this is a totally different epidemiology from the first 2. The dormitory residents live in very artificial settings of high population density, and its inadvertent consequence was that there was a rapid transmission undetected among asymptomatic, apparently well individuals. Because most of them are young, they also did not manifest many symptoms, and they were actually quite fit. But the infection spread silently within the dormitories, and we saw this progression from March all the way to August. And this required very extensive measures by the Singapore authorities to help break the chain of transmission in the dormitories. Please take some time to read this cartoon. It's provided under the COVID Chronicles in the National University of Singapore Medical School. Dr. Dale Fisher, my friend, is cartoonized in a series of these very interesting comics. Basically, this young man thinks that COVID is not a problem for the young, okay? So they can do what they like, party. But actually, COVID is everybody's problem. And the young also, there have been instances of fatalities and complications even, all right? And indirectly also, the young, they do have this risk of being a vehicle of the transmission and bringing it back to people who are at risk, immunosuppressed people, maybe their parents who are elderly, and that is also a very scary state. So you see that the prevention and control of COVID requires a whole of society approach, not just those who are impacted, but also others, all right? So we need to be considerate of the consequences of our actions for everyone. So now I'm going to continue with the second takeaway on beliefs and behaviors, that we always need to give a bit more than we take for it to be sustainable. I take you back to April 5th this year, where a super spreading event started, all right? What is a super spreading event? We heard about this during SARS. Super spreading events are situations where an index case can transmit infection to 10 or more other people. And in fact, if you look at the epidemiology of the SARS virus and now the COVID-19 virus, one of the key for the coronavirus transmission are certain people who, for reasons of either genetics or environment, have this propensity to spread to multiple people, and this starts a super spreading event. And again, in Singapore this year, we had super spreading events which triggered widespread transmission of COVID-19. If you look at this epidemic curve, okay, you can see that our super spreading event at a time when we were already occupied with multiple active clusters took place sometime in the late March, early April. And you can see that the Ministry of Health at that time, the contact tracers were swamped with work non-stop 24/7, all right, trying to identify where the community clusters were occurring and what were the transmission factors that gave rise to these clusters. So little did we know at that time that as we were investigating so many different clusters, one was going to become a mega cluster, super spreading event of epic proportions. And this was actually originating from the Mustafa Center, okay, a popular shopping mall where tourists and locals frequent. And initially, just like the other clusters that we had, just like the Safra Jurong cluster and a few other of the local clusters in churches and so on, we just saw Mustafa cluster as possibly, another one of those that will slowly burn itself out. But no, this did not happen. We had at that time 22 cases linked to Mustafa. Quite a number were staff, and this was quite worrisome. Then the visitors, we only have the visitors who came from within Singapore. There were many visitors who probably went to Mustafa and then flew home, whom we do not have any means to identify nor contact. And so this is probably just the tip of the iceberg, okay? Tip of the iceberg means that for every case that we see, there could be multiples of these cases that we do not see because we do not have the surveillance. And you can see that quite a number of our visitors from Singapore, the types of occupations they had, and also had dormitory residents, all right? So this was the key. Our investigations further led us to see a chain of infection from Mustafa Center to some construction sites, and this is just one of the sample of construction sites that started showing COVID cases, Project Glory Construction. And unfortunately, from the construction site, because there were different teams of migrant workers and each one had a different dormitory to which they returned, they went back to multiple dormitories, such as the Cochrane Lodge, the 511 Dom, Tampines Dom, Toguan Dom, and the Sungai Tengah Lodge. And from there, unfortunately, cases started to spread again. And you can see the problem because within these dormitories, where there are foreign workers who also go to other construction sites, then other construction sites can also run the risk of being a focus of infection and then transmission. So we can see that this transmission really established in a massive chain. Okay. And when we did the network analysis, we found that 13 cases with onset of symptoms in March actually had visited the Mustafa Center during their infectious period. You see, even with mild symptoms, if you go out, there is a risk that you can be the source of an infection for an outbreak. All right. Employees were likely infected initially when they had contact with these visitors who were infectious. For all you know, there could have been some imported cases, visitors from overseas who had come done shopping at Mustafa, transmitted to the employees, and then left the country. Anyway, the result was that these employees had lived, worked, socialized amongst themselves, and therefore transmission spread. And 2 employees who developed symptoms on 18 and 28 March had continued to work while symptomatic, although at that time already we had told employers that if your employees develop symptoms, do not ask them to come to work. Okay. Infection spread through close contact during interactions at work or gatherings for meals and breaks at common rest areas. This was established through our history taking, our backward tracing. And then we found that visitors to Mustafa were probably infected from the staff when they visited the Mustafa Center. So you can see on the right side, a Channel News Asia graphic that showed the very complicated network of cases. And this was a lot of detective work that the Ministry of Health together with the Singapore Police Force had to do to elucidate all this transmission. To their credit, this was a very comprehensive investigation that yielded effective prevention and control measures. So what were the hard lessons that we had to learn? If you look at the learning points on the right side, because Mustafa Center had a total 129 cases, stay home if sick, even if symptoms are mild. Second, masks should be worn in public and good hand hygiene should be practiced. In the early phase of this outbreak, because there was a shortage of surgical masks, the government did not encourage people to wear masks in public to save all these surgical masks for the healthcare workers. But I think as the evidence started to mount, masks became more available. There was a total turnaround, and now masks worn in public is the good practice. Workplaces should implement safe distancing practices and should practice team segregation when feasible. This was not observed early in the outbreak, but today we have this as a standard operating procedure for our employers and workers. Safe distancing measures should be implemented at shopping places. Easier said than done. As in restaurants, okay, recently you've heard about some people who did not observe safe distancing even though they were supposed to be in different bubbles. This is an ongoing exercise which requires self-responsibility and social responsibility on everyone's part. Okay, temperature screening is also not a fail-safe measure. Although some people have mild symptoms, others who actually had temperature have been shown to actually slip by temperature screening because of calibration issues with the equipment. Not everyone who has a fever may be picked up. Okay, this would be what we call a false negative. And all supermarkets and convenience stores should ensure regular cleaning of common touch points for customers, like supermarket trolleys, baskets, and the ATM keypads. Because if someone has touched these and it was infected, then these surfaces then could become a fomite source of contamination that could transmit the infection to others. Okay, dormitory clusters, 3 months after the initial cases, still burning, so you can see that actually because our population is susceptible and if people live close together, it is very hard to control this disease. It's highly virulent, able to spread from person to person rather fast. Okay, so you can see the list just goes on, and in fact MOM together with the other authorities had to devise measures to relook at the way our dorm workers are housed. There are new standards which are required. The current dormitories have a 4.5 square meter per resident and 12 to 16 beds per room practice, with only one toilet per 15 beds. But under the revision, the improved dormitories now will have more than 6 square meter per resident, less than 10 beds per room, and one toilet designated per 5 beds. See, it's not that the dorm workers were more unhygienic. Sometimes it's because the reality of their living conditions were not conducive for the prevention of the spread of the disease. All right. So we still monitor all the lodges and dormitories, the purpose-built dorms, as well as the factory-converted dorms. Take some time to read this. It was very interesting exercise that we experienced over the painful months that we had this burning COVID transmissions. There were a lot of things that we needed to understand, all right? Cultural, social, basic human values, concerns, all of us have, okay? So I think it was a good experience in the sense that anything that we fail, if we learn something from it, that is value add. Okay, so in summary, to manage the foreign worker mega dorms, by the way, these mega dorms existed because Singaporeans practice what we call not in my backyard. They didn't want foreign workers in the neighborhood. So a lot of the dormitories were built in far away places where tens of thousands of these workers were housed in high-rise conditions, all right, and very clustered together. The outbreak exposed structural problems in how these foreign workers lived, needing deployment on site by support teams comprising the SAF, the SPF, and MOM. The government had to work with all the dorm operators to relook at the hygiene, safe distancing, and effective management in all these dormitories. Active screening and testing also had to be conducted because that was the only basis for us to be able to have proper surveillance and monitoring with on-site medical support and movements minimized to prevent further spread, okay? And because we minimized the movement, we also had to look into the logistics of providing to the daily needs and salaries and food and other issues with the foreign workers. So those who were well and also those in essential services had to be decanted to reduce congestion in the dorms, and community isolation facilities had to be created on the fly in many parts of Singapore, okay? So basically, I think this was a wake-up call for Singapore, and our society today has awakened to the inequity issues and doing right by leading positive change, okay? We can see that the community also has a role to play against COVID-19. And if you focus on sickness, you're going to end up with the doctors. But if you focus on well-being, you're going to end up with communities. And I have my privilege here to introduce my colleague Yvonne Chua, who is a senior manager in charge of the community at Yishun Health, to give you a bit of the experience in the community against COVID-19. Yvonne, please.
Thanks, Dr. Wee, for inviting me to share a little bit of the stories that our community have been telling us over the past few months. So hi, everyone. Good morning. My name is Yvonne. So I am part of the Population Health and Community Transformation team here at Yishun Health. So our work is slightly different from our hospital colleague. So in a pandemic like this, our hospital colleagues will be very much focused on addressing the issues within the hospital. So making sure that we have the right capacity to take care of our patients and take care of people who are ill. My team, uniquely, we work very closely in the community. So during this pandemic itself, we were focused on the well-being of the community members. So to give you a bit of a sense about the work that we do, consider your own neighborhood. So what we would usually do is we look for people from different walks of life with different assets. So we like to call this our discovery journey within our own local neighborhood. So we look for things that people are interested in, skill sets that they already have, things that they already are keen and passionate about doing. So we connect them with people of similar interests. We connect them with local assets. So it could be if they are keen to volunteer, we'll connect them with different social service agencies. We'll connect them with more neighbors who maybe have an interest or is looking to learn from them. So what we want to do very much is to welcome everyone so that everyone has is bringing something to the table. So like what Dr. Wee was saying, the growing pie. So everyone is always contributing to the growing pie so that there's always enough for everyone. So I would like to share with you the story of 3 of our residents here in Yishun. So we'll start off with Alice and Sharon. So they're both in their 70s. So during the circuit breaker period, they started to make masks for their friends. Eventually, when they saw that more and more people weren't able to get stock of surgical masks, they made more for neighbors, for cleaners in the neighborhoods. They went on their own distribution walk to give away to the elderlies that were that they know that don't have a lot of support. I will also introduce to you Rosalie. So during the circuit breaker, he felt very strongly about the elderly Muslim community, elderly who lives in his neighborhood that weren't able to celebrate Ramadan and Hari Raya with their families. So he rallied his neighbors and got together to do something. Finally, we'll also introduce to you Fauzia. Fauzia recovered from COVID-19 with the help of neighbors.
We can see less contact between people around us.
可以说半个小时就包一次，半个小时就包一次。Spanish flu or something like that, you know. I say, wow, this time is jialat liao.
Because there's no Hari Raya also during COVID. So what we do is we try to cheer them up by giving them this Hari Raya kuih, the soft drinks, and things like cakes or something in a packet. So we give to those Muslim community here.
每个 nurse 每个医生都这么忙，然后我们可以做什么？对不对？我说我们可以做，我们可以帮到的，不是说了，反正也不可以出去吗？不可以出去就是整天吃了。
because during 这个 COVID 那个 mask really 很少
买不到，很多都买不到。
所以我就想到 the most important 那些 frontline workers should need 最重要的。So I say since you learn approach me, then 我有时间 then 我就说能够帮就帮，所以这些 mask 可以给另外一班人用啦，叫跟那些 frontline 抢就是这样咯。
My family, my customers, even strangers, which is I don't know until now, send me tingkat meals, send my family meals, tingkat meals, frozen food, dried foods, canned food, so many stuff until that. Then my husband don't know what to do with it. So what I told him, put everything one side. So when I came back from the hospital after I was discharged, I actually donated it to those who really needs it. Then I even cook some meals and give out just to like a way of saying thank you and appreciation. Family will always help us. Family will always be there for us. But the nearest is our neighbor. So to be good, so we should be good to each other. The friendship, the relationship, the bond have to be created.
What I hope to see is that everything goes to normal. But even though there is a vaccine that has been patented and created and it's proved that it is can cure this COVID-19, like care thinking about your neighbors and your community. Yeah, it's just not because of COVID. It's like the community is safe from all this, right? Then everybody less stress.
Thanks, Yvonne. This is a sharing to show you how just ordinary people like you and me can actually do our part if we observe and we see a need. And this is really building community resilience. But community to be resilient needs relationships, and relationships are built on trust. So my third point, which I need now to go back to the slides, is really that trust can only be built on relationships. So therefore, do not take relationships for granted. I mean this at the national level. I mean it at the community level. I even mean this at the family and personal level. All right. The challenges ahead for us, this is not going to be old normal anytime soon. Okay, a lot of us maybe wishful thinking is that once we get a vaccine, we are going back to the old normal. No, there will always be challenges ahead, and sustainability will be a key consideration in how Singapore moves into the new normal. Okay, we already talked about fighting against compliance fatigue, because like you all also in the poll just now found the measures onerous. All right, so does the rest of the general population. Ensuring sufficient healthcare capacity in case of a surge event in the future is also important. And at the same time, with our aging population, we also need to provide for the healthcare needs other than COVID. So I think our healthcare is severely stressed. We do need to ensure that there are sufficient resources for this. Providing healthcare workers also the support and protection as they have been battling since the early this year. They also can get tired. They also need the affirmation that they deserve, right? And also, as the signs of the infections continues to be uncovered, the evidence-based approach in management of COVID and needs to be improved as we prepare ourselves to adapt to this new normal. Okay, so basically you can see that with all these challenges and sustainability being a key consideration, it cannot be just, oh, what is the government going to do about this? Why is the government taking so much time? Why are they so slow? When are they going to? It cannot be so, because the government cannot do a lot of things which the whole society can. All right, so it must be a total approach to tackle this crisis, and therefore government and community must strengthen trust through relationships with each other and within ourselves. All right, here is the strategy to manage COVID-19. This is not rocket science. Every country does it, but some countries can do it effectively while others are still stumbling. The first one is to minimize the risk of importation. Singapore is a trade and travel hub. Okay, in fact, it's our lifeblood. We got no choice. We must continue to have trade and travel with the world, and therefore we must have a robust mechanism of monitoring, detection, early and control to prevent importation of disease, right? Then there's also the need for vigilance in the community. Early detection and containment are the keys to addressing any clusters that happen in the community as well as in the dormitories. So let me touch on each of this. To minimize importation, we are taking a risk-based approach to border reopening. So the risk of importation is being assessed through all kinds of data and the WHO, and the risks are also being mitigated, okay, through the different travel lanes with public health measures commensurate to the assessed risk. Our proposed tie-up with Hong Kong failed because Hong Kong developed clusters at the last moment, but our intent to open up with Hong Kong still continues. And in fact, the model of our link with Hong Kong is also going to be the model for opening up with many other cities in the world. We will continue monitoring the global situation, other countries' situation, and also to adjust our border measures to manage the risk of imported cases and any spread. For early detection, one of the strategy is enhanced surveillance. So case presentation, we use the WHO suspect case, and we even expand on their case definition. We are more kiasu actually. Test all individuals who have pneumonia and acute respiratory infections also for COVID. And we do screen target groups such as the asymptomatic high-risk groups. And I told you about the RRT for foreign workers living in dormitories. They have routine rostered testing. And nationwide, we have HBB set up screening centers throughout to support the testing as the key strategy, and the activation of the GP clinics known as the public health preparedness clinics. Second strategy in early detection is the active case finding, and here we have a contact tracing process which is second to none in the world. We have a very well established contact tracing center, and we have cases and close contacts quickly identified and ring-fenced, and tested contacts of confirmed cases at start and end of quarantine. The technology is also being used to drive and help improve the very labor-intensive work. So we have the trace together as well as the safe entry. And I hope you are all helping out with the Trace Together and Safe Entry. Yeah? And for investigations, the chain of infection has been established for every case. So you can see that we are putting a lot of effort into the detection and containment of cases of COVID, especially in the community. Rapid identification and isolation of confirmed cases. We monitor the number of days when they have symptoms to the time they're isolated in hospital. And pleased to say that actually it has been pretty good. The time that they are out in the community potentially spreading infection has been effectively reduced as much as possible. Singapore is also aware that we cannot live as a bubble alone. We must show solidarity with the world. So we monitor the global situation, and international cooperation is vital. All of us play our part in the global health crisis. We have also close communications with WHO and counterparts of other countries, especially in the ASEAN region, because this virus, not respecting borders, can easily be a problem in one country, is a problem to other countries. Singapore remains open for business, even as we take the precautions necessary. So our phase reopening, you just heard the PM speak early this week on the gradual resumption of activities going into phase 3 by 28th December. Our safe management measures must continue to be one of the cornerstone of our opening up. And based on the risk assessments that we have, we will continue to ease gradually, but we may have to take this dance, which will take us 2 steps forward, 1 step backward, as and when we decide that, oh, okay, this is not working properly, or the people's responsibility needs to be improved before we can open up further. Okay, so phase 3 requires this shared responsibility and consideration for one another. Okay, so I think we can look forward to a more normalized way of life, although it will not be the old normal. Okay, and I think that we indeed today already enjoy a lot of freedoms that many other societies and cities around the world today, under lockdown, under all kinds of constraints, get fined here and there and forced to their greatest consternation. We have kept the community cases low for many months now, allowing us to ease. And I hope that all of us can do our part to help everyone return to normal as fast as possible, because there are also, as Kin Long has showed, mental health issues involved. Okay, so stay patient, everyone. So in summary, today we talked about 3 takeaways for beliefs and behaviors that affect our lifestyle. Community, we have to prepare for the long haul. This is not a sprint, a marathon. Sustainable society must rise above self. We must give a bit more than we take, so that it is an increasing pie, okay, that we share. And trust can only be built on relationships, so never take our relationships for granted. Okay. Thank you. Wish you all a Merry Christmas and Happy New Year.